So we're with Dr. Nigel Watson, GP lead for West New Forest. Could you tell us a little bit more about the Pharmacists in Practice event that we've had today?
Well, today we're launching a new initiative in our multi-specialty community provider. We've placed pharmacists in each of the practices, the general practice, and the aim is for them to work with the GPs looking at a range of things from repeat prescribing, electronic prescriptions to polypharmacy, people on 10 or more medications, people in care homes, people who are discharged from hospital, working towards better support for GPs in terms of long-term conditions. Many long-term conditions are based on management with medication, and therefore they can add some capacity to the system. They can use their training and skills in an effective team. What's different about our initiative to some of the other pharmacists based in practices, that the pharmacists form part of the medicines optimization team in the clinical commissioning group, and we've expanded that team so they spend anything from 2 to 3 days working in a practice, working with the practice, but then linking together. So they're not working in professional isolation. We're sharing education, training, initiatives such as going into a care home. So one pharmacist will be attached to one care home working with the practices who have patients registered there, but also then linking into the hospital pharmacists and the community pharmacists. So we can improve the discharge process and ensure patients get on the right medication. Working with the community pharmacists, looking at things such as the ordering system, the wastage, and the inappropriate use of medication. Also working with our patient participation groups. We, in the 7 practices population of about 70,000, spend about £13.5 million on medication a year. We estimate that probably 10% of that spend is on medication that's taken from the pharmacist but not used by patients, and probably anything up to another 10% may be medication that's ordered and never used by patients because they didn't think they requested it. It's part of 10 medications that they're on. So we think there's huge potential to improve quality, expand the workforce, and also have an impact on things such as unnecessary hospital admissions, where we know about 10% are due to medication reasons. So for all those things, we want to improve quality, we want to make better use of resources, and we want to free up people's time.
Okay, so when will this be rolling out across the West New Forest?
It started, so the official launch was today, but the pharmacists started their placement in practices about 6 weeks ago. They've been going through a period of integration in the practice and training, but the last pharmacists took up their posts 2 weeks ago.
And what do you think the main benefit that the patients and public are going to see by the pharmacists being based within the practices?
In a way, the success of it will be that the patients may not notice any significant change. So the aim is to provide better quality prescribing, to reduce unnecessary medication in the elderly, but patients may not see that as a major difference. What they might find is that rather than the GP phoning them about a medication switch or coming home from hospital, that it's a pharmacist who's part of the team.
Okay, Fab. Thank you very much.